Namaskar. My name is Sandhya.
My name is Bhavani.
We are both volunteers of SewaTT, and today we will be discussing some of the best practices for home isolation of a suspected or confirmed case of the coronavirus that is not kept in the hospital.
At the moment, in our country, all cases of individuals who are suspected or infected with COVID-19 are being quarantined in a hospital. It is important to note, if there's a serious outbreak of the virus, no country has the resources to quarantine everyone in a hospital. Here are some tips for home isolation.
In the case where an adult member of the home is infected or suspected to have contracted the coronavirus, isolation is the key to prevent the spread to other family members. This person should stay at home, and he or she should not have any visitors. At home, this person should also separate themselves from family members. A minimum distance of 6 feet is recommended by the authorities. If there are children present in the household, they should be properly informed of the situation and they should be monitored to prevent them having contact with this person.
This person should be kept separately in a well-ventilated room, and the door must be kept shut. He or she must frequently wash his or her hands and should not eat on the table with their family members. In a household, if there are numerous bathrooms, one should be allocated for the use of the infected person only. However, if there is only one bathroom, it should be well sanitized using disinfectant agents such as Dettol and bleach after the infected person uses it. Towels and toiletries should not be shared.
Places such as the kitchen must also be sanitized using disinfectant agents. Clothes and bedspreads of this person must be washed separately using disinfectant agents. This would prevent the contamination of other clothes. The waste of this person must be disposed of separately and double bagged. The person doing the disposal must take necessary precautions such as gloves and washing hands properly after with soap.
When delivering food, medication, or change of clothes, this should be left outside the door. The person should have separate eating utensils that are properly disinfected after use. In terms of entertainment, without leaving the room, he can read a book, watch videos online, watch movies, or do some yoga. Remember, it is important to distance yourself from the infected persons, so activities such as board games will not be advised.
In the case where a child is infected or is suspected to have contracted the coronavirus, the same procedures must be followed. Again, separation is the key to prevent the spread of the virus. The child must be kept in a separate room and must be monitored. Keep the child occupied to prevent him or her from leaving the room. Books, toys, videos, and movies can be used. It is important that the devices or toys used by this child not be shared with other children in the household. If it needs to be used, it must be properly disinfected.
In terms of washing clothes, disposing of waste, and sanitation, the same procedures must be followed. In an event where the child cannot eat for themselves, the person feeding the child should wear gloves and wash their hands properly afterwards. The same should go if they have to change the child's clothes, bathe them, and give them medication.
Together we can help stop the spread of the coronavirus in our homes and our communities. We are all in this together.
Wishing you good health, and remember to follow the guidelines stated by the authorities. Stay safe.
Namaskar.
Namaskar.